My name is George Strawley. I am the engagement specialist with the network of the National Library of Medicine, which is the outreach arm of the National Library of Medicine, part of the NIH in Bethesda, Maryland. It's located. I, though, am based at the University of Utah at the Eccles Health Sciences Library. I'm a faculty position, but as a librarian, but I do I work under this grant with the NNLM. Um, and we do health information outreach in the Mountain West and the Dakotas. We do a region that extends from the Canadian border to the Mexican border, basically the Mountain West and the Dakotas. We work with health organizations, community-based organizations, public health departments, and libraries of all types and sizes. Really, just anyone whose job it is to deliver health information. We like to reach out to, and I hope to give you an outline of training opportunities with NNLM, and if there's time, throw in a little information on how public libraries are supporting public health. There will be 3 QR codes during this presentation. I'll probably drop a couple of URLs in the chat too. So these will get you connected to some of the key web pages. So if you're a QR person, you might want to have your device on hand. First, a disclaimer, I am not speaking for the National Institutes of Health today or the National Library of Medicine, although I am funded under a grant from them. This content is solely the responsibility of me, and does not necessarily represent their views. Okay, for an agenda today, we will give an overview of the NNLM program. We will look at the distribution of public libraries and public health locations in Utah. I should mention that this was originally done with a public health audience in mind. I understand that there's a lot of community groups together, but as Annie was saying, there's an intersection of missions there between the public health organizations and the community organizations, as you well know. And I would also like to put forward the idea that there's an intersection with libraries just as much, because they are locally based public service organizations, and and among their missions, their mission is to provide information, but that includes health information as well, which we'll talk about. And so, and I hope to provide some examples of how libraries in Utah and elsewhere are supporting public health initiatives, whether formally or informally. So let's move on. This is just a little promo for our podcast. The podcast is actually they're not going to be adding any new episodes, but there are some interesting things on here, and it can kind of tell you what libraries are capable of doing to support health and health information. There are libraries that are doing programs like supporting disaster emergencies, providing a place where people can go and file their FEMA reports and things like that. There are libraries that are stocking little free libraries with health information. We have one of those. If a little free library is if you've ever seen it, is one of those kind of like mailbox things where they show up in neighborhoods, and people can put in a book, they can take out a book, and so some libraries are stocking those with reading material, including health information, and also supporting telehealth by providing a place where people can have a telehealth appointment. So I will move on, and this is NNLM. I want to give you a very brief thing about NNLM. Like I said, we're the outreach arm of the National Library of Medicine, and I mentioned my region 4 is our region, which is that orange area that extends from Montana down to Arizona and New Mexico. You can also see there are also coordinating offices and centers. We're located at 7 university libraries around the country. All told, in Utah, we have 49 NNLM members as of last count. There might be more now. Membership is free, by the way. I'm going to mention that. Everything that we offer is free. The membership includes public libraries, academic libraries, hospital libraries, but also community organizations. For instance, we have the Health Occupation Student Association on the list, which is a group that uh, works with K to 12 students who are interested in health occupations. And we have a couple of K to 12 schools and state agencies as well. Um, Public health efforts are often tailored to address the unique challenges of individual communities. Public health specialists working in both rural and urban areas develop innovative strategies and leverage local resources. They ensure community members receive the care and support they need. Libraries can be one of those resources. We cover nearly a million uh, land miles in Region 4, square miles, and many of them are rural and frontier areas. So we understand the challenges that you might be meeting in your communities. And there's a very diverse audience that we serve as well. Um, so we have a National Public Health Coordination Office, which manages access to evidence-based public health resources. I mentioned this because you might have used some of these resources in something known as the Public Health Digital Library. You might not have even known that you used them, but if you have ever relied on resources from either from the University of Utah's Eccles Health Sciences Library or the Utah Department of Health and Human Services, then you might have used the Public Health Digital Library to get to those resources. So things like journals, like some of the ones listed here, like the New England Journal of Medicine, Nature, you can get those for free. You can get articles from them for free through the Public Health Digital Library. You would go to either Eccles Health Sciences Library or the Utah Department of Health and Human Services to access those articles. And this is a list of the top journals. You'll see that there are some well-known journals. There's also some very specialized things like the Journal of Wildlife Management and Transportation Research Records. But there's also things like Nature and Annals of Internal Medicine, things like that are more widely published journals. Um, so what we do is we work on outreach, training, and funding. So at times we will have funding available for health information projects, as well as training. We have a number of courses which I'm going to mention that are available. I'll talk about those in a moment. But that QR code there will get you to our website, which is nnlm.gov. It's a very easy one to remember, nnlm.gov. Okay, so that's a little bit about NNLM. I want to talk a little bit more about libraries in general. This map, all those purple dots there with the library logo on them, these are all the library systems around the country. There's 17,278 public library branches and bookmobiles in the United States. Nearly 80% of those library systems serve less than 25,000 people. So if you come from a small community, this is a common thing that libraries around the country work in. And those are just the public libraries. When you add in higher education libraries like my library, a huge number of K to 12 libraries, and then special libraries, armed forces libraries, government agency libraries, you end up with more than 130,000 facilities. Now let's take a look at Utah specifically. On this map, the orange squares there are the public health departments. Like I said, I originally did this as a public health presentation. Um, those are the public health departments, and then the green dots are the public libraries, the system offices and the local branches as well. Um, so you'll notice that a lot of them are in very close to each other, which makes sense because they're very locally serve. They serve the local community, so they're going to be located in the central communities of the state. So a lot of the green dots are right on top of the orange squares. Um, and like I said, that makes sense because they're both locally focused agencies. Um, Moving on, uh, this map just shows, or chart shows, that there is a lot of cooperation between health departments and libraries. This is how it fared over the past few years. You can see that there is a lot of cooperation, but there's room to do more if we want to. It was down low, and then COVID hit around 2020, and this number started going up. Uh, and the latest data we have is 2022, and that was at 22% of local health departments having some kind of formal agreement with libraries. Now, there's also a very high percentage of libraries that work in some way, or health departments that work in some way with a local library. This might be something as simple as maybe having um, uh, a health presentation at at the library, or making meeting rooms available for even, say, a community group to discuss a health related topic. Usually at the library, there are meeting rooms that are available that really are open to the public. I've seen things like at the library that I used to direct. I mean, we had uh, public meetings there. We also had birthday parties there, you know, all sorts of different things. It depends on the policy of the local library, but it is definitely something worth looking into if you need space. Personal health literacy. One of the most impactful ways libraries can transform public health is by supporting health literacy. This is the definition for what is known as personal health literacy. This was from a report called Healthy People 2030. It's a government report. Um, Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health related decisions and actions for themselves and others. This definition, like I said, comes from a document called Healthy People 2030, which is a set of goals for public health that are updated every 10 years. We are looking forward to 2030, so it's known as Healthy People 2030. They change it, they update it every 10 years. Um, and I'll mention that there's personal health literacy. There's also organizational health literacy, which is the ability of organizations to let their members, or enable their members to become health literate. And the important part of this definition, as it's something that Annie alluded to earlier, is the ability to uh, enable people to make health important health decisions in partnership with their health provider. Um, okay. Um, so health literacy goes beyond reading skills. It covers every aspect of how a person uses health information. So it covers some of the things mentioned here. So it includes basic literacy, but it also includes numeracy, basic biology. You don't need to know a lot of clinical information, but do need to know how a circulatory system generally works, or something like that. You have media literacy, the ability to determine what's good information and what's bad information, to use media, and digital literacy, the skills to actually um, work a tablet, or look up something on your health record system, which is maybe being used more and more by medical providers. You can't make an appointment these days without being able to operate a health a health interface. Um, so those are some of the skills that are involved. Now I'm going to get into some of the programs that we offer, including some courses that deal with a couple of certifications called the CHIS and the CHES. I will go briefly over these. Um, the just to clarify one thing up front, there is something called the CHIS and there's something called the CHES, and they're not the same thing. Okay. And they have very similar goals, so it's easy to get them confused. But we're going to talk about them because they're great opportunities to um, for you or your staff to um, um, get the skills needed to provide reliable health information. So the CHIS is something that's offered through the Medical Library Association, and we teach most of the courses dealing with it. It stands for Consumer Health Information Specialization. And like I said, that's a program offered by the Medical Library Association, and it offers training in providing health information services to consumers and recognition for their accomplishments in acquiring new health information skills. It was originally designed for library staff, and a lot of the courses are library focused, but the information can easily be applied to a community health setting or a community organization setting. Um, so that's the CHIS. And some of the areas where you could gain skills are we have certain competencies in our program, such as understanding your community, the essentials of health literacy, mental health resources. We have a course on that, how to evaluate health information, and sometimes health disparities as well. We get into. Um, and communication and instruction. There are two levels of CHIS, level one and level two. You can earn a level one CHIS by taking 12 continuing education credit hours of classes. And the CE credit is offered by the MLA. Um, and then you can earn a level two CHIS by taking an additional 12 hours of credit that cover three more competencies. And those are literacy and health literacy, technology and health, and ethical and legal issues. Okay. Um, Most of our courses are online, although we do sometimes have some offerings at professional conferences and the like. We have done some of the course content at the Utah Health Literacy Coalition meetings, and those are, by the way, those are really good meetings to go to if you don't if you don't get the chance to go to them. And I will remind you that our content is free. Um, they tend to be in one of three formats. We have online webinars that are scheduled for specific times, and sometimes, and a lot of them are available on YouTube. They're recorded. We have asynchronous courses in which you interact with your classmates and one or more instructors by posting on forums and doing assignments. Um, and then we have on-demand classes that you can do at your own pace. Okay. Um, and also, I'll mention that you can teach any of these courses for free. You can teach them. They are in the public domain because this is a government project, so they're in the public domain. And we have courses. Some of the courses that we have are listed there: effective health communication and health literacy, providing mental health information at your library, providing multilingual health information, rural health resources, and making sense of numbers. Um, and if you want to teach the content, I suggest reaching out to me um, or someone at NNLM to get some more information on how to coordinate and support. We like to support you in your efforts to do that. And then I'll also mention that there is a $75 charge for the MLA certification that you get. You can take the courses without getting the certification, but if you want the certification, there is a charge. However, NNLM sponsors the certification as long as we've got money for it. So we have sponsorships for the CHIS certificate, and if you use that QR code there, it will take you to information on how to apply for the sponsorship so that you don't have to pay the fee for the certification. Okay. Um, and I'll skip this slide and just tell you, if you don't need the CE credit, you still might want to watch some of our classes or browse the NNLM through the NNLM YouTube page, um, because we have a lot of recorded. We also have national and regional webinars that might interest you. Some of the topics we've had recently include empowering teens through media and health literacy, promoting walking for health in rural communities, from contraception to menopause, identifying and addressing reproductive health misinformation. Those are the kinds of courses and webinars that are available. Okay, I'm just going to skip through CHES very quickly just to say that we do offer courses related to the Certified Health Education Specialist program. That's another different type of specialization that is put out by the National Commission for Health Education Credentialing. So if you have community health workers in your employ, this might be a great place to go to get courses for CHES certification. Um, and just know that some of those courses are taught by NNLM. They include the courses on public health, health literacy, disaster planning, things like that, rural health as well. Okay. And I'll skip this slide and go to this slide. Um, so this is a good link. This is the National Public Health Coordinating Office, which manages that public health digital library that I mentioned earlier. And now we go to the other things, CHES, and the other things. And we're going to start with Medline Plus. Medline Plus is a great resource for finding consumer health information. Now, we distinguish between what we call consumer health information and clinical health information. Um, the National Library of Medicine also runs something called PubMed, which uh, operates, which is the database, or a database, a citation database for academic journal articles on medicine. It's commonly used by med students, by um, faculty at med schools, by clinical people, doctors in hospitals, things like that, when they want to look up a particular medical issue. This will provide a citation and perhaps even a link to the article in in an academic journal. But that is going to be your high level clinical information. It's going to be written on a very high level for information that's accessible to the everyday person. You're probably going to want to go to Medline Plus, and this is more for patients and also their caregivers as well. And I'm just going to show you the page, and then I'm going to transition over to the website to show you a couple of things here. That's the home page there. Let's do a little demo. First thing I'm going to show you, especially since this is a group focusing on multilingual issues, is that this website is fully available both in English, and if you click on this a link over here, it's also available in Spanish as well. So the full site is available in Spanish, and you can switch back and forth between the two. So what you have here is you have a number of a whole bunch of health topics. But by the way, let me start by saying this is all information that's curated by the National Library of Medicine. It is evidence-based information. Most of it comes from government sources, but there's a lot of nonprofit organizations that are linked on this site, as well as hospitals that put out reliable health information, things like that, like the Cleveland Clinic. You'll find articles from there on there here as well. Health topics. So this is one of the links here. We've got health topics. We've got drugs and supplements. We've got a medical encyclopedia. We have information on medical tests, genetics, healthy recipes. And down here, I want to point out easy to read health information. Although I find that all of the information is written, on a fifth to sixth grade reading level for the most part. But there's even um, uh, lower grade levels in the easy to read health information section. There's also health information in multiple languages. I'll show that in a second, as well as something called clinicaltrials.gov. I don't know if I'll have time to show that, but if I do, I will. Health topics. So if you go here, you find a menu of topics here. And if you want to drill down, let's say we want to go to, we'll take the first one, blood, heart, and circulation. We go there and we drill down. We have an A to Z list of different topics related to blood health and the circulatory system. So if we go to arteriosclerosis, we get an article on arteriosclerosis and what it is. There's a summary article, what it is, what causes the condition, who is likely to develop it, what are the symptoms, what are the problems. It goes on and on from there. And you also have over here, you have the links to medical encyclopedia articles, as well as, this is very helpful, related health topics. So if you've got somebody who says, they told me that I have to have an angioplasty, you can click to this related link and you get the same article for angioplasty. You can also do a search in this box. So if I put in high blood pressure, all right, you've got a number of articles. You've got high blood pressure medicines. You also have high blood pressure in children. Let me see what happens if I just do high blood pressure. Yeah, it gives me an article on high blood pressure, what it is, how to prevent it. It also gives you a list of related articles here. Some of these are going to be higher readability articles, but most of them should be pretty easily accessible to the average everyday reader, even someone with limited literacy skills. And you can see there's the full article right there.
George, will you share real quick the patient handout? Yeah.
Patient handout. Where is
right
it?
Where you were. You were
Oh,
just
there
there.
it is.
Yep.
Yeah, patient handouts. Yeah, here are different patient handouts on different topics as well. So if we go to high blood pressure and eye disease, something I never thought of before, you get something on how high blood pressure can damage blood vessels in the retina, and some information related to that, the causes, the symptoms, also some stuff on exams and tests. So that is related to that. Now I'm going to go back to the homepage for a second, and I want to show medical tests real quickly. You've got all the different tests that listed here. So, if we go to um, basic metabolic panel, something that's commonly prescribed, this tells you what a basic metabolic panel is, and the different components of it, the glucose, the calcium, different things like that. And again, what is used for, why do I need it? Questions like that. Okay.
George, I do have a question.
Sure.
Are there infographics on this website that the public is able to use?
There are some. There are. I'm trying to think of how to get to one. Let's go back. I think you'll see that more in the easy to read materials. You'll also see it probably in the medical encyclopedia. But if we go here, and we go, I'll just pick this. here we've got things like this. I don't know that we have too many infographics in the sense that you're probably thinking of, more the patient education material. But there are some, and there are links to some as well.
Okay, great.
Yeah.
Yeah, thank you.
Okay. Thanks for the question. I appreciate it.
Yes.
Okay. Let me show you. In addition to the medical tests, there's also drugs and supplements. So if we go to L's, and I'm looking for lisinopril, which is a blood pressure medication, you get an explanatory article on lisinopril. Somebody says that I've been prescribed this drug. What does it mean? All right. There's also some other resources for meds that I'll show you in a moment. Okay. I apologize if I'm scrolling too fast. I know that can be distracting. Last thing I want to show you is health information in multiple languages. This is what Annie was mentioning a little while ago. This is not as exhaustive as the English and Spanish sites. There's just, a limited amount of resources to do all the different languages. But there is information that mostly gathered from other sources in a multitude of languages. You can see all of them listed here. So we were talking about Swahili before. So let's click on Swahili. And here you find different handouts on different issues in Swahili. So if I go to COVID-19, if I remember right, this has, let me actually go to this one. Yeah, there we've got a COVID-19 explanatory written in Swahili. And you'll find this for a host of languages. These are, you can find different handouts, for different conditions. Like I said, everything is not included in here. It's just impossible to do everything, but there is a lot of information, and most of them come from. I've seen stuff from state health departments around the country in there. I've seen it from federal sources as well, and private nonprofit organizations as well. So that is Medline Plus. I'll pause there. I know I went through that kind of fast. I apologize, but if there are any questions on that, I'd be happy to answer them.
So one thing I wanted to share is, as community representatives or as community health workers, we participate in so many publications, like as co-authors or as authors. But one thing I realized that we don't pay attention into tracking what we participate in.
Mm-hmm.
And this is really important, like for our resume or just for our record. This is
Mm-hmm.
one of the places that you can go to if you want to see how many publications, or if you want to keep a record of the
Mm-hmm.
publications you participated in. So I would advise people to go there, and you'll be surprised to see how much work you have done.
That's a really good point. Yeah, and I especially recommend PubMed for that. If you've been a partner on a co-author on an academic journal piece, PubMed is really good for picking up those as well. So I wasn't going to do PubMed, but I just want to mention that that's out there as well. Yeah, so that I see another question. Are there any health resources for people who are illiterate? Good question. Like I said, there's the easy to read health information if we're talking about somebody with low literacy. But I also I want to point out, here we go, health videos, Medline Plus. So these are all health videos that are offered through Medline Plus, and they cover a number of different topics. You know, you see allergies, Alzheimer's disease, things like that. So if we click on Alzheimer's disease, you get this little video, and you can't hear it, but there is audio to that as well, and it explains what the how Alzheimer's disease works. So that is that. Okay. And all right, with that, I'm going to show you a couple other resources. I want to show you DailyMed. DailyMed is a we were talking about medications earlier, and like I said, there are resources in Medline Plus for that. There is also DailyMed, which is you know those handouts you get in your pharmacy bag when you pick up a medication. Well, this has those texts in there. So if you wanted to go over, if you're working with a patient and you wanted to go over what's recommended in the medication circular, you could go in here and you'll find all the medications listed. Escitalopram, which is another blood pressure medication. You can go in here and you can get the information, the same information that's on the drug label on the handout with your medication. So I wanted to show you that. It includes things like the warnings and precautions, various things like that. Okay. All right. So that is DailyMed, and that is dailymed.nlm.nih.gov, and or you can just Google DailyMed. It comes up that way as well. I'll also show you something called clinicaltrials.gov. This is probably, you'd be less likely to use this, but if you wanted to point somebody who has a serious illness to places where you could get if somebody doesn't have coverage and they want to participate in a clinical trial to perhaps get some treatment that way, you can go to breast cancer and you get a list of all the different clinical trials that are going on involving breast cancer, and then you can actually limit it by let's say those that are recruiting right now, and do a filter that way. And those, let's say we only want children as subjects. We could do that. And then where's our filter button? I'm not finding it. Okay. Oh, there it is. Apply filters. There you go. So now you are talking about, actively recruiting clinical studies involving children. So I wanted to show you that. I've got another one I want to show you. This one I just added at the last minute. This is EthnoMed. This is done by a hospital in the Seattle area. And it is information specifically geared toward various cultures, that are around the world and in different countries. So let's say we have it divided by clinical topics. We also have it divided by cultures and languages, and these are all the cultures and languages that are represented here. You see, you've got Afghani, Cambodian, all the way down to Vietnamese. So if we did, let's say Somali, we could find a background. This is This is especially useful for not so much for your patients, but for your staff. If you wanted to provide them with background information on a culture, you're going to find that information here. The geography, history, and politics, language, how interpersonal relationships in a particular culture work, um, how to greet and display respect for someone in that culture, general etiquette, uh, family and kinship relationships, things like that are going to be in the culture and language section. And then if you go to the clinical topics section, let's go to cardiovascular. You will find different articles, both for pay providers or for patients, that address issues in a particular a culture. So you've got Cambodian terms for hypertension may cause misunderstandings about the disease. So you've got an article alerting you to potential misunderstandings, cultural misunderstandings, in discussing hypertension with people of a Cambodian background. And then for patients, let's see what we've got. We've got This is more um, general information. So you've got information about hypertension, um, and it's in Amharic, English, and forgive me, I don't know exactly how to pronounce this, but Tigrinya, um, and you've got a 2-page PDF available in those 3 languages, which are available over here. So there, you've got a handout in Amharic on what do we say, hypertension. So that is EthnoMed, it's called. And then the last one I want to show you is this is we call them in the library profession, we call them LibGuides or live guides. They are put together by library staff, and they just round up all the different resources that are available on a particular topic. And I just discovered this one on health information resources for underserved populations, multicultural and multilingual health resources. And I got this through just a very simple Google search um, uh, for health information resources in multiple languages. And this is put out by the University of Florida, and you'll see links to things like EthnoMed and other um, uh, resources like prescription medicine instructions and health information translations. Let's just look at health information translations for a second. We've got all sorts of health topics. If we want to do exercise and rehabilitation, we've got different languages that are available for materials on exercise and rehabilitation. So if we go to Hindi and active hand exercises, we get a list of a handout on hand exercises available in English and Hindi. Okay. So I wanted to point out those resources to you. And let's go back to our presentation. Let me see. And I wanted to show you just real quickly a couple of resources that are available, or not resources, but programs that libraries do that are related to health. And these are commonly done by libraries. They don't even necessarily connect it to, there are community organizations and health organizations out there that would be interested in knowing that we do this. But these are commonly done by libraries. There are things like pop-up bike clinics, which is a health issue. So by promoting, but for instance, there was one library that partnered with Bike Utah and did a pop-up bike clinic. This was the Kearns Library, and they helped people with their bikes. They did some basic safety training, and the idea was to promote healthy use of bikes, doing biking. There are also regularly a lot of libraries that do exercise classes. A lot of libraries lend out equipment for health purposes. So you might be able to get some weights check out weights at your local library. There are a lot of libraries that lend out tablets so that people can look up health information or communicate with their doctor. And then there are also wanted to mention story walks. So story walk is something. It's a healthy activity where there might be a park setting, or a lot of libraries are next to the park, so they do it there. But they'll put out placards that have the pages of different storybooks, and like a picture book or something like that. And you can walk through the course and read the picture book as you go along. And this is done as an outdoor activity. And this is a hiking program that the Salt Lake City Library did, where they kind of introduced people to hiking, and helped them with some of the basics of it. They did it in some of the trails behind the Foothill Library on Foothill Road or Foothill Drive. So that's one possibility as well. This is another type of story walk. I just wanted to show this because I love looking at the pumpkins here. This is a pumpkin walk where the Utah State University Brigham City campus did a pumpkin walk where they had different pumpkin displays, and the library contributed this one, which is different characters from children's books painted up as pumpkins, but painted up in pumpkins. So I always like to show this because you can kind of try to guess some of them. I know number 5, that's very easy. Number 4 is very easy. That's Amelia Bedelia. Number 1 there, or maybe it's 11. That's tricky. That is, what is it called? Chicka Chicka Boom Boom. There's a book called Chicka Chicka Boom Boom. And you know that one? Yeah. Okay. So that's Chicka Chicka Boom Boom. The 7 I'm still stumped on, but I don't know who that is. But 6 is Little Critter. But anyway, those are the kinds of activities that can actually get people up and moving, and in a way that's both interesting, stimulating, physically and intellectually as well. Okay. Also, a lot of libraries lend out blood pressure kits. I'll mention that. This is a program that was done by the American Heart Association, where they funded about 50 some libraries across the state to provide blood pressure kits to lend out. And I will leave it at that, other than to acknowledge that a whole bunch of people helped us with collecting this information. And these are some links to different resources that are available for the NNLM. And you can always email me if you want more information on any of this, or if you just want to talk about funding, things like that. So thank you very much.